Today we are going to discuss about stroke. What is the stroke? Before we proceed to the definition and detailed description of the stroke, let us recall our previous lecture, ischemic heart disease. What is the ischemia? Ischemia, if there is reduction of oxygen rich blood, if there is reduction of oxygen rich blood to the tissue, is called ischemia. If there is reduction of oxygen rich blood to the cardiac muscle, is called ischemic heart disease. Similarly, if there is reduction of oxygen rich blood to the brain tissue, is called ischemic brain injury. If there is reduction of oxygen rich blood to the tissue, is called ischemia. If there is reduction of oxygen rich blood to the cardiac muscle, is called ischemic heart disease. Similarly, if there is reduction of oxygen rich blood to the brain tissue, is called ischemic brain injury. Ischemic brain injury, this leads to a stroke and TIA. Ischemic brain injury lead to the stroke and TIA. Similarly, ischemic heart disease, as we discussed previously, lead myocardial infarction and angina. Serious cerebrovascular accident. Cerebral vascular accident, this is condition in which oxygen rich blood to the brain is suddenly blocked. CVA includes stroke and TIA. If there is damage or death of the brain tissue due to the ischemia, is called stroke or brain attack. I think it is clear now. Serious cerebrovascular accident is a clinical condition in which there is reduction of the blood flow to the brain. If the oxygen-rich blood supply to the brain is suddenly stopped, is suddenly blocked, is called cerebrovascular accident. Cerebrovascular accident include a stroke and TIA. If there is damage or death of the brain tissue due to the ischemia, is called stroke or brain attack. Let us further clarify it. Stroke is a neurological neurological deficit stroke is a neurological deficit due to vascular events of brain. Sudden stroke is a neurological deficit due to sudden vascular events of brain. Stroke is classified, or we can say, into there are two types of a stroke. One is the ischemic stroke, other type is hemorrhagic stroke. There are two main types of stroke. Ischemic stroke 85%. Ischemic stroke is more common. Hemorrhagic stroke is 15%. Ischemic stroke is further divided into cerebral thrombosis and cerebral embolism. Ischemic stroke is further divided into cerebral thrombosis and cerebral embolism. Cerebral thrombosis is due to thrombus formation in the artery leading to the brain. The most common cause of cerebral thrombosis is atherosclerosis. The cerebral embolism is due to wandering clot or stray clot that form elsewhere in the body, such as in the heart or in the carotid artery, and it will travel through the vessel and block that particular vessel that leading to the brain, resulting into ischemic stroke due to embolism. The most common cause of cerebral embolism is the atrial fibrillation. Hemorrhagic stroke is further classified into two types. One is intracerebral hemorrhage, other is the subarachnoid hemorrhage. Intracerebral hemorrhage is the most common type of hemorrhagic stroke. In both types, in intracerebral hemorrhage and in subarachnoid hemorrhage, the blood vessel rupture and there will be discontinuation of blood supply to the brain, so resulting into a stroke. Intracerebral hemorrhage, the blood is the blood vessel burst or blood vessel rupture. There will be accumulation of blood in the brain parenchyma is called intracerebral hemorrhage. The most common cause of ischemic intracerebral hemorrhage is the chronic hypertension. Subarachnoid hemorrhage, most common cause due to the aneurysm such as berry aneurysm. Aneurysm is actually a blood-filled sac or blood-filled pouch that protrude from the artery. Suppose this is the artery, this is the aneurysm. This is the aneurysm. Blood-filled sac that is protruding from the artery is called aneurysm. In case of a subarachnoid hemorrhage, there is the rupture of this aneurysm, number one. Or there may be arteriovenous malformation. Arteriovenous malformation as well in subarachnoid hemorrhage as well in intracerebral hemorrhage. In subarachnoid hemorrhage, the blood will be accumulated between the skull and the brain. As we know, the brain is covered by the three protective layers, the meninges, that is pia mater, that is the arachnoid, and the topmost is the dura. Middle one is the arachnoid. In case of subarachnoid hemorrhage, there will be the accumulation of a blood in subarachnoid space. So it is called subarachnoid hemorrhage. Clinical manifestation, symptoms and signs of a patient who presented with a stroke. You have to remember acronym FAST, F-A-S-T. Fast, pace, dropping. Ask the patient to smile and observe for pace dropping or deviation of the mouth. Arm weakness. Ask the patient to raise his or both arm and look for dripping downward of arm due to the weakness. S, speech difficulty. Maybe patient presented with the speech difficulty. Ask the patient to repeat a particular sentence such as the sky is blue, and patient is not able to repeat it due to speech difficulty. T means time to call emergency medical services. Because for the management of stroke, time is crucial. If you observe, are the patient presented with these signs and symptoms, always call to emergency medical services for the management of stroke. F. Face dropping, A. Arm weakness, S. Speech difficulty, and T. Time to call emergency medical services. Also, patient may be presented with paralysis with weakness of one side of the body, and maybe their speech difficulty or understanding there. There may be loss of vision in one or both eyes, or maybe patient presented with the diplopia, or maybe their loss of balance or coordination, or patient may be presented with the severe headache with no known cause. These are sign and symptom of stroke. Now let us discuss the risk factor. What are the risk factors for a stroke, or who is at risk to get a stroke? Risk factor, there are two types of risk factor. One is the controllable risk factor. Other is the uncontrollable risk factor. Controllable, these are modified risk factor. Uncontrollable, non-modified, we can't modify them. These are non-modified risk factor, uncontrollable. Uncontrolled risk factor include age. We can't change the age of patient. A stroke can occur in all age and can occur in infant, children, young adult. Even a stroke can occur even before birth. But it is most commonly occur 65 years. Other non-modifiable risk factor or uncontrollable risk factor is the gender, that is the sex. Female are prone to get a stroke due to the pregnancy. Pregnancy itself is a hypercoagulable state, and female get a stroke due to the eclampsia and preeclampsia, due to the usage of OCP that contain estrogen, female using certain hormonal therapy containing estrogen that lead to thrombus formation. The third one is the hereditary. If there is family history of a stroke, hereditary. Age, gender, hereditary, these are uncontrollable risk factors. We can't control them, we can't modify them, so it is called non-modified risk factor. While those risk factors we can control them, called controllable risk factor or modified risk factor, such as smoking is a risk factor for stroke. We can quit smoking. Hypertension is a risk factor. We can control hypertension. Diabetes mellitus is a risk factor. We can control it, we can treat it. Hyperlipidemia, lipidemia is a controllable risk factor, modified risk factor. Obesity, we can reduce weight, or physical inactivity, controllable risk factor. Other certain drugs such as alcohol, amphetamine, cocaine, heroin, these certain drugs can cause a stroke. And what are the other controllable risk factors, such as certain diseases, hematological disorder, such as sickle cell anemia, can lead to ischemic stroke. Hemophilia, it is a bleeding disorder, can lead to hemorrhagic stroke. And certain cardiac diseases such as atrial fibrillation. These all are the controllable. We can change them, we can modify them, we can treat them, we can cure them. So-called controllable risk factor. While other are uncontrollable, we can't control them, we can't change the gender of someone, we can't change the age and heredity of someone. Investigation. Investigation are divided into three categories. First, to confirm the diagnosis. Second, to find out etiology. Third, to find out causes or risk factors. Investigation for a stroke divided into three categories. First of all, we have to confirm our diagnosis. Then we have to find out the etiology and risk factor. To confirm the diagnosis, we will do CT or MRI brain for vascular diagnosis. To find out the etiology, we will do ECG to look for atrial fibrillation, echo to look for any cardiac disorder, and to do duplex ultrasound of carotid arteries. To find out the etiology, we have to do ECG, echo, and Doppler ultrasound of carotid. To ascertain the risk factor, we have to do the CBC to look for polycythemia, polycythemia, increased viscosity of the blood as a risk factor for stroke. We have to do lipid profile for hyperlipidemia. As we know, the hyperlipidemia is a risk factor for stroke. We have to do blood sugar. As we know, the diabetes mellitus is a risk factor. And we would like to do the clotting or thrombophilia screening. As we know, hemophilia is a risk factor for hemorrhagic stroke. First, we have to confirm the diagnosis by doing CT or MRI brain, then to find out etiology and risk factor. Treatment options for ischemic stroke. First, we will discuss the treatment option for ischemic stroke. The definitive treatment for ischemic stroke is alteplase. Alteplase is actually a recombinant tissue plasminogen activator. Alteplase is a clot busting drug. It is an anti-clotting agent. It dissolves the clot and reduces the disability due to the stroke. And it maintains the flow of blood to the brain by breaking up the clot. It is given within 3 to 4 hours of onset of symptoms of stroke. It is given within 3 to 4 hours of onset of symptom of stroke. So, when you get any patient with sign and symptom of stroke, you have to call to the emergency medical services, because the alteplase, it must be given within 3 to 4 hours of onset of symptom of stroke to be more effective. The second is the mechanical thrombectomy. Mechanical thrombectomy. If the clot is very large and is not able to be broken down by alteplase, then we use the mechanical thrombectomy to remove that thrombus. Alteplase and mechanical thrombectomy are definitive treatment options for ischemic stroke. Other options is the dual antiplatelet therapy such as aspirin and clopidogrel. Aspirin and clopidogrel is given for secondary prevention. The fourth option, carotid endarterectomy. If there is carotid stenosis more than 70 to 99%, we have to do carotid endarterectomy. Fifth option, treatment of risk factor. If your patient is diabetic, you have to treat the diabetic to prevent further stroke, to prevent more attacks of stroke in future. If your patient is hyperlipidemic, if your patient is having high blood pressure, you have to treat them according to the risk factor. These are the treatment options for the ischemic stroke: alteplase, mechanical thrombectomy, dual antiplatelet therapy, carotid endarterectomy, and treatment of risk factor. What are the treatment options for hemorrhagic stroke? The management or treatment of hemorrhagic stroke is depends on its causes and etiology. Surgery is indicated in case of hemorrhagic stroke. In case of aneurysm, we apply a metal clip at the base of aneurysm. If bleeding due to the arteriovenous malformation, AV malformation, we have to remove these abnormal vessels by surgery. And we have to prescribe medication to control hypertension. Chronic hypertension is a risk factor for hemorrhagic stroke. We have to prescribe medication to control hypertension. The definitive treatment for hemorrhagic stroke depends on its causes and etiology. Surgery is indicated in case of aneurysm and AV malformation. In case of aneurysm, we are going to apply metal clip at the base of aneurysm. In case of AV malformation, we have to remove these abnormal vessels by surgery.